Have you ever noticed a strange sensation that lasted only a few minutes, something unusual enough to make you pause, but not dramatic enough to call for help? Maybe one side of your face felt slightly numb for 30 seconds. Maybe you struggled to find a simple word mid-sentence, and then it came back to you. Maybe you felt a brief wave of dizziness that passed so quickly you convinced yourself it was nothing. And because it went away, because it did not persist, you dismissed it. You told yourself you were tired. You told yourself you had been standing up too quickly. You told yourself it was stress or dehydration or just one of those things that happens as you get older. But what if I told you that fleeting moment, that brief symptom that disappeared within minutes, could have been your body's final warning before a catastrophic stroke? What if I told you that the day before a major stroke, your body sends very specific signals? Signals that most people either do not recognize or choose to ignore because they seem too minor, too brief, too insignificant to act on. I am here today to tell you something that could genuinely save your life or the life of someone you love. Those transient symptoms are not minor. They are not insignificant. And ignoring them could be the difference between full recovery and permanent disability or death. My name is Dr. Nathan Brooks, and today we are going to talk about pre-stroke warning signs, the subtle signals your body sends in the hours or day before a major stroke that most people miss entirely. Today you are going to learn what is happening in your brain when these warning symptoms occur and why they disappear so quickly. The 5 specific sensations that appear most commonly in the 24 hours before a stroke, the critical difference between a warning stroke and a full stroke and why that distinction could save your life, and exactly what to do the moment you or someone near you experiences any of these symptoms, step by step, with no confusion and no hesitation. In 15 years of clinical practice, I have sat with families who have told me, "He mentioned his arm felt weak yesterday morning, but it went away, so we thought nothing of it." I have heard, "She said she felt dizzy the night before, but she seemed fine an hour later." And in every one of those cases, that seemingly minor symptom was a warning, a final opportunity, an alarm bell that went unheard. Today, I want to make sure that if your body sends you that warning, you will recognize it, you will understand it, and you will act on it immediately. Before we go any further, I want you to drop a comment below right now and honestly tell me, have you or someone close to you ever experienced a brief neurological symptom, something like numbness, weakness, vision change, or speech difficulty that disappeared within minutes? Just tell me yes or no. I read every single comment personally, and today, your answer genuinely matters. And if you have ever been told by a doctor or family member that it was probably nothing and not to worry, please add the word dismissed to your comment because I want to know how many people watching this have been given that dangerous response. Now, let me start with something important that I think most people have never heard explained clearly, because understanding this one thing changes how you think about stroke risk entirely. A stroke is not a single event that appears out of nowhere with no warning. I want you to really hear that. In the majority of ischemic strokes, which account for about 87% of all strokes, the process begins long before the major event. Your brain has been operating under increasing stress. Blood flow to certain areas has been gradually compromised. Small clots have been forming and dissolving. Arterial narrowing has been progressing silently. And then, often in the hours or day before the major stroke, your body gives you a preview, a rehearsal, a warning stroke. The medical term for this is a transient ischemic attack, or TIA. But forget the clinical language for a moment. In plain human terms, here is exactly what is happening inside your brain during a TIA. A small blood clot temporarily blocks blood flow to a specific part of your brain. That part of the brain, starved of oxygen, stops functioning properly for a brief period. If that area controls your right arm goes weak or numb. If it controls your speech, you suddenly cannot find words. If it controls your vision, you lose sight in one eye or see double. Then, within minutes or sometimes within an hour, the clot dissolves or moves, blood flow is restored, and the symptoms completely disappear. You feel normal again. And because you feel normal, you assume the danger has passed. But here is the critical truth, that TIA was not the danger passing. It was the danger announcing itself. And here is something genuinely important that most people over 60 need to understand about why this happens more frequently as we age. As we get older, the arteries that supply blood to the brain become less flexible. Plaque builds up along the arterial walls. Blood pressure becomes harder to regulate. The blood itself becomes slightly more prone to clotting. This means that factors which might have caused only a mild headache at age 40 can cause a TIA at age 65. And a TIA at age 65 can lead to a major disabling stroke within 24 to 48 hours if not treated immediately. Understanding this context is essential because it explains why the warning signs I am about to describe have such life-or-death urgency in older adults specifically. I have a patient I want to tell you about. A wonderfully active 71-year-old man named Robert, who came to see me 3 months after suffering a major stroke that left him with permanent weakness on his left side and difficulty speaking. When I asked Robert to tell me everything that happened in the days before his stroke, he paused and then said something that has stayed with me ever since. 2 days before it happened, I was reading the newspaper and I could not see the left side of the page, just for about 5 minutes. Then it came back. I thought my eyes were tired. Robert had experienced a classic TIA symptom, a visual field cut, a temporary loss of vision in one half of his visual field caused by interrupted blood flow to the visual cortex of his brain. Had Robert gone to the emergency room the moment his vision returned, had he been evaluated and treated within that critical window, the major stroke that happened 2 days later could have been prevented. Robert did not need complex surgery. He needed immediate medical evaluation, imaging to identify the clot source, and medication to prevent clot formation. That is exactly what today is about. Making sure that if your body gives you the warning Robert received, you will act on it immediately. But wait, because the most important warning sign I am about to describe is one that I find most consistently gets dismissed by patients and even by family members who witness it. And it is responsible for a very significant proportion of missed TIA diagnoses in older adults. So please stay with me because this is the part that changes everything for most people. Warning sign number 1, sudden difficulty speaking or understanding speech that resolves within minutes. This is the most commonly dismissed warning sign I see in clinical practice, and it is one of the most dangerous to ignore. What happens during this type of TIA is that blood flow is temporarily interrupted to the language centers of your brain, most commonly in the left hemisphere in an area called Broca's area or Wernicke's area. When this happens, you might suddenly find yourself unable to speak clearly. You know what you want to say, but the words come out garbled or slurred. Or you might find that you cannot understand what someone is saying to you, even though you can hear them perfectly. This can last anywhere from 30 seconds to 10 minutes. Then it resolves completely. And because it resolves, people tell themselves, I was just tired. I got confused for a moment. But here is what you need to understand. If speech or comprehension is affected suddenly and then returns to normal, that is not fatigue. That is not confusion. That is a neurological event caused by interrupted blood flow to your brain. And the research is unambiguous on this. Approximately 10 to 15% of people who experience a TIA with speech symptoms will have a major stroke within 90 days, and the highest risk period is the first 48 hours. If you or someone near you suddenly cannot speak clearly, cannot find words, or cannot understand speech, and this lasts for even 30 seconds before resolving, you need to call emergency services immediately. Do not wait to see if it happens again. Do not wait until morning. Call 911 now. Warning sign number 2, sudden weakness or numbness on one side of the body. This is the warning sign that appears in approximately 50% of TIAs, and it almost always affects one side of the body specifically, not both sides simultaneously. You might notice that your right arm suddenly feels heavy or weak. You might try to lift it and find that it does not respond normally, or your right leg might feel numb or unsteady when you try to stand. Sometimes this affects the face. One side of your face might droop slightly or feel numb. What is happening is that blood flow has been temporarily interrupted to the motor cortex, the part of your brain that controls movement on the opposite side of your body. The critical detail here is the suddenness. This does not develop gradually over hours or days. It happens suddenly, within seconds or minutes, and then just as suddenly it resolves. Strength returns. Sensation returns. You feel normal again. Many people experiencing this will shake their arm, assume it fell asleep, and move on with their day. But numbness from a compressed nerve, like when your arm falls asleep, develops gradually when you have been lying on it. TIA numbness appears suddenly with no positional cause. If you experience sudden one-sided weakness or numbness that resolves within minutes, this is a medical emergency. You need brain imaging and evaluation immediately. Before we go further, tell me in the comments right now, did you know that stroke warning signs could disappear completely and still require emergency treatment? I want to know because many people watching this are learning this for the first time, and your comment helps me understand how many people need this information. Warning sign number 3, sudden vision loss or vision changes in one or both eyes. This warning sign appears in approximately 10 to 15% of TIAs, and it takes several different forms. You might suddenly lose vision completely in one eye, like a curtain descending over your field of view. This is called Amaurosis Fugax, and it happens when a small clot temporarily blocks the artery supplying blood to your retina. Or you might lose half of your visual field in both eyes. You look straight ahead, but you cannot see anything to your left or your right. Or you might suddenly see double. 2 images where there should be 1. These symptoms typically last from a few seconds to a few minutes, and then vision returns to normal. And because vision returns, people convince themselves it was an eye problem, not a brain problem. But sudden vision changes, especially if they affect both eyes or if they involve seeing double, are almost never caused by the eye itself. They are caused by interrupted blood flow to the visual cortex in the back of the brain or to the cranial nerves that control eye movement. This is a TIA until proven otherwise, and it requires immediate emergency evaluation. If this information is opening up new possibilities for understanding warning signs you or someone you know may have experienced, I want you to hit the like button right now. It genuinely helps me reach more people who need this life-saving information. And if you are not yet subscribed, please subscribe now and hit the notification bell so you never miss these critical health conversations. Warning sign number 4. Sudden severe headache, unlike any you have experienced before. Now, I want to be very specific here because not every headache is a stroke warning. But a sudden, severe headache that reaches maximum intensity within seconds, often described as the worst headache of my life, especially if it is accompanied by any other neurological symptom, can indicate a very specific and very dangerous type of stroke called a hemorrhagic stroke. This happens when a blood vessel in the brain ruptures and bleeds. The sudden pressure from the bleeding causes the intense headache. Sometimes this type of headache is accompanied by nausea, vomiting, sensitivity to light, or a stiff neck. If you experience a sudden severe headache that feels different from any headache you have had before, particularly if it comes with vision changes, weakness, or altered consciousness, this is a medical emergency requiring immediate hospital evaluation. Warning sign number 5. Sudden dizziness, loss of balance, or difficulty walking. This is one of the most commonly dismissed warning signs because people attribute it to inner ear problems, low blood pressure, or simply getting older. But when a TIA affects the cerebellum or brainstem, the parts of your brain responsible for coordination and balance, you can experience sudden severe dizziness, difficulty walking in a straight line, or a sensation that the room is spinning. The key distinguishing feature is, again, suddenness. You stand up and suddenly the world tilts. You take a step and suddenly you cannot maintain your balance. If this is accompanied by any other symptom, double vision, slurred speech, weakness, this is almost certainly a TIA and requires immediate evaluation. Now let me address something critically important that many people get wrong, and this misunderstanding causes dangerous delays in treatment. Many people believe that if the symptom goes away, the danger has passed, and there is no need to seek medical attention. This is absolutely false, and it is potentially fatal. A TIA is not the danger passing. It is the danger announcing itself. Research shows that after a TIA, the risk of a major stroke is highest in the first 48 hours, and approximately 1/3 of people who experience a TIA will go on to have a major stroke if they do not receive treatment. But here is the critical piece of good news. If you seek treatment immediately, if you are evaluated, and the cause of the TIA is identified and addressed, the risk of a major stroke can be reduced by as much as 80%. That is not a small difference. That is the difference between life-altering disability and full recovery. That is the difference between life and death. Let me now bring everything together with a clear action plan you can implement immediately. If you or someone near you experiences any of the following, call 911 immediately. Sudden difficulty speaking or understanding speech, even if it lasts only seconds. Sudden weakness or numbness on one side of the body, face, arm, or leg. Sudden vision loss or vision changes in one or both eyes. Sudden severe headache, unlike anything you have experienced before. Sudden dizziness or loss of balance with any other neurological symptom. Note the time the symptoms began. This is critically important because certain stroke treatments are only effective within a specific time window. If the person is conscious, have them sit or lie down safely to prevent injury from falling. Do not give them food, water, or medication. Their ability to swallow may be impaired even if it does not appear so. Stay with them and monitor for any changes in symptoms. The medical team will perform brain imaging, typically a CT scan or MRI, to determine whether the event was caused by a clot or a bleed. They will evaluate the blood vessels supplying your brain using ultrasound or specialized imaging. They will assess your heart rhythm and function because certain heart conditions significantly increase stroke risk. Based on these findings, they will begin treatment, which may include blood-thinning medication, blood pressure management, or in some cases procedures to remove clots or repair damaged blood vessels. You will likely be started on medications to prevent future clots. These might include antiplatelet drugs like aspirin or clopidogrel, or anticoagulants if a heart rhythm problem is identified. You will work with your doctor to manage stroke risk factors, blood pressure, cholesterol, diabetes, smoking cessation, and weight management. You will have follow-up imaging and monitoring to ensure the treatment is working. Your brain has an extraordinary ability to recover if you act quickly, but that recovery depends entirely on recognizing the warning signs and responding to them immediately. That brief moment of weakness, that fleeting difficulty with speech, that temporary vision change, these are not minor inconveniences to monitor at home. They are your body's final alarm before a catastrophic event. Now you have the information to recognize that alarm and to act on it without hesitation. In my next video, I am going to talk about the 5 most important lifestyle changes that research shows can reduce your stroke risk by more than 70%, even if you have a family history of stroke. You are not going to want to miss that one, so please make sure you are subscribed and have your notification bell turned on. If this video gave you something genuinely valuable today, something that could save your life or the life of someone you love, please share it with your family and friends. That share could make a real difference. Remember, this video is for informational and educational purposes only. Always call emergency services immediately if you experience any warning signs of stroke. If you found this video helpful, don't forget to subscribe to the channel and hit the notification bell so you never miss a health tip. Take care of yourself, and remember, when your brain sends a warning, listen. I'll see you in the next video.